So our facility for more than 20 years has the role of translational and clinical production of cellular therapy. Let's start by understanding what translational means. Usually research activities are carried out using reagents that of course are just for research purposes. Translational is the activity that moves all the experiment from research to clinical application. What does it mean, you would say? First of all, it means that we think big and not on a small scale. It means that we have to analyze all the reagents that are used in research setting and looking for suitable ones to be used in patients. Practically, it's a kind of a bridge activity between basic research and clinical application. And the second aspect of our work is the cellular therapies for clinical purposes. So cell therapies and the organoids, of course, are made of cells, are under the GMP rules. GMP, what means GMP? GMP means good manufacturing practice. And it's not an easy concept to explain, but let's say that a cell therapy product is exactly like a drug. And for the regulatory bodies, this means some rules that we have to follow. So we need facilities, exactly like the one that we have here, that are constantly inspected and certified by regulatory bodies. This is very good because it's done, of course, to guarantee that the drug that will be used into the patient will be a safe drug. And usually all the research experiments are generally carried out in unclassified environments like the one where we are now. But obviously these environments must be suitable for maintaining the sterility of cell culture, but not in hyper-controlled environments, for example, from the microbiological point of view. With the GMP, we have to deal with the clean rooms, for example, with the controlled pressures, with particles and microbiological counts. So what are pancreas organoids? Generally speaking, organoids are three-dimensional cellular structure generated from induced pluripotent stem cells as well as from adult tissue progenitor cells. They are minimal biological units which exhibit functionality and complexity similar to those of the tissue of origin. Organoids, I think that they can be an important bridge between two-dimensional cultures and in vivo models because they are more physiologically relevant than monolayer cell culture, but at the same time they resume very well the function of the organ of origin. So speaking about pancreas, human pancreas organoids recapitulate perfectly the phenotype of pancreas, ductal epithelia in vitro, and they can be differentiated into endocrine lineage cells in vivo and in vitro. From the research point of view, we still need to confirm the ability of organoids to functionally replace an entire organ with appropriate in vivo studies, of course. And from the clinical point of view, researchers and clinicians have to identify which is the therapeutic dose. In the meantime, I want to be positive because we demonstrated the feasibility of a standardized large-scale organoid production. And this is, in my opinion, is an important step to accelerate the use of organoids in patients. Our translational and GMP skills often fit very well in projects that want to bring basic research into clinical application. Therefore, it's not our first experience into European programs. But I have to admit that this particular project and this consortium have been very stimulating for us and very challenging from a scientific point of view. Until a few years ago, no one talked about organoids and no one has ever thought of bringing organoids in the context of regenerative medicine. Therefore, it has been a great experience and I hope that this project will have additional funding to continue in this direction and to continue till the clinical application.